Okay, well, thank you for having me in your class today. We're going to talk about some integrated screenings, which is a way to see individuals who have a type of disease, particularly chronic diseases, before they even have symptoms. And so it's a way to assess the risk, the low or high risk that they have for a particular disease, even before they have to go to the doctor. They might even have this disease and not know it, or they may be really close of having it. And that's where having an intervention or teaching them about how to prevent it can really make a difference in their lives. So really, thank you for doing this training with us and learning on how to help the family members and friends and the community around you that can really benefit from something like this. So my name is Marco Verdeja. I work for Intermountain Healthcare with the community health team. And so we, among many other things that we do, is we screen for these diseases in the community. So we look at those people who have not yet had to go to the doctor or haven't gone to the hospital and are in our communities, people that you know. And as we screen for these diseases, we try to find out if they're at risk of having them. And so we're really excited to be able to do this with Latinos in Action and you guys, because you really have the ability to go where um, sometimes even doctors or us can't go. For example, you can go and screen your families, and maybe they haven't gone to the doctor in a long time, even because they haven't felt bad, or when there's lack of insurance, or they don't have a primary doctor. And so we don't see them, right? And you could be the first person to notice that they're at risk for one of these diseases. And also, we're hoping this really helps you to be a champion in the community for health, because knowing and having this education and awareness can really make you a resource for others to be able to understand and know what to do or where to go if they have questions or they want to know more about diabetes, high blood pressure, or some of the other things that we'll talk about today. So we're really excited to be able to have this micro credential with Latinos in Action and all of the support that Latinos in Action gives to this program. So I'm glad that you are taking it seriously and doing this micro credential that can also help you in the future be part of your resume. And we've even known of students who have gone jobs in healthcare that have come from them doing something like this. So really, really excited to talk to you and share a little bit about these screenings and what you can do in your community and for your families. So we're going to talk today about three different screenings. And like I said, a screening is a way to measure for risk. It might be that they have the disease and don't know it, or it might be that they are at high risk for that disease. But a screening can let you know whether or not you are at risk. Now, it's not a diagnosis. It's not telling them that they have the disease. For that, you have to do other types of things or like other tests. But this can get you started. And so we'll talk about diabetes, high blood pressure, and social determinants of health. So let's get started with diabetes. Now, you may have heard about diabetes. many of us have family members who have diabetes, because at least 1 in 3 adults have pre-diabetes. And so someone in our family is going to have it probably. Now, another important thing about diabetes is that it has no symptoms. So you can have the disease and feel completely fine. There's no problems. You don't feel anything wrong. For example, if you were walking out of your class today and you fell, and when you got up, your arm is twisted, it hurts a lot, and you can't move it, well, immediately you're going to think, oh, it's broken. That's the first thing that you're going to think, because it's pretty obvious, right? And so if that happens, you're gonna go to the doctor and go to the hospital immediately. But if you feel completely fine and you have no symptoms, nothing hurts, then you're probably not going to go to the doctor. We should go at least once a year for a general checkup, but most people don't. And so because diabetes is a disease that has no symptoms for, it can be years even, then um, then people can go for many years having diabetes and it's still affecting their body, but they just don't know about it until it's really late, and some other ugly consequences happen, like the ones that we're going to talk about of what diabetes can do. So that's the big problems with diabetes, not knowing about it and how common it really can be. Now, we can do things if we are having, if we have someone who has pre-diabetes, that means that's someone who is very close to having diabetes. They're at high risk for it, and most likely in the future they will have it if they don't make some changes in their lifestyle. But at that moment, it's still preventable. We can make some changes that don't have to be drastic, can be small changes to our lifestyle that can really make a difference and prevent someone from having diabetes in the future, which is huge, because like we're going to talk about, there's so many problems that come with having diabetes. Once we have diabetes, though, diabetes is a disease that has no cure as of right now. In most cases, diabetes has no cure, and all we can do is treat it or treat the symptoms from then on. So we can really prevent someone from getting it. That's the best way, because then they won't have to either take the medication or take the precautions or suffer through the many different problems that come along with diabetes. So that's why screening is so important, because if you can find someone before they get diabetes, you can really change their life. Now, there's different types of diabetes that we have. There's basically 4. Type 1 happens in children, and it's mostly genetic. And so there's not much we can do about that one. It's genetic and it happens, and so we treat it with medications and insulin. Type 2, though, this diabetes happens typically in adults, though it's happen in younger and younger people because of our lifestyle and how we eat and how we exercise. But this type 2 diabetes is the most common one of all diabetes, and it's the one that's preventable. For this one, we can do things to prevent it from happening. Now, there's other types of diabetes like autoimmune, which is like type 1, but for adults, and gestational, which happens during pregnancy and typically goes away after the baby is born, although it does put risk for type 2 diabetes later in life. But the most common one is type 2, and the one that we can really do a difference with as well, because it's preventable. So we talked about this already, but so many people have either pre-diabetes or diabetes, and it really kills so many individuals here in the United States as well as around the world because of the different problems that can happen due to diabetes. So really quickly, let's talk about what diabetes is and how it happens in our body, right? So our body uses glucose, which is sugar, as a source of energy. It's one of the sources of energy that our body uses. So as we eat things, our body breaks it down, and our intestine absorb those that glucose, and that glucose goes into our circulatory system. So our arteries take that glucose, so our blood takes that glucose all across our body, and then it gets absorbed into every single cell of our body that uses it for energy. And that's what should happen. However, with people who have these, what happens is that as we absorb that glucose from our intestine, goes into our blood system, um, there's a problem with the absorption of the glucose into the cells. So essentially, the sugar or that glucose stays for too long in our circulatory system, in our arteries and veins, and so the sugar level that's in our blood rises above what should be normal, and it just stays there for too long. And our circulatory system, it's great at transporting glucose, but it's not so great. It does not like to have just glucose sitting there. Think of it as a highway. If you have a large truck going through the highway, it's no problem, right? It just goes through. But if it breaks down and it stops in the middle of the highway, it's going to start causing lots of problems for the circulation. So it's the same thing with us. If the sugar is not transported into the cells, and then it starts causing problems in our arteries and our veins, and so it starts damaging the lining to the point that it can even block some of those really tiny arteries called capillaries, and then it starts causing problems all over our body because of that high level of sugar that shouldn't be there in our blood. So essentially, that's what happens with diabetes. And so people have to take medications or even insulin that takes that sugar from our blood into the cells to try and manage that. And of course, they have to limit the amount of foods that have sugar and eat less of that, and control the levels of sugar in their blood, which can then do lots of damage across our body. And so, like we talked about, there's so many different problems that can happen, right? Because as we said, this happens all over the body, right? Because they can damage our arteries and veins everywhere. So it can go from having a stroke in our brain to having problems with our eyesight, our kidneys, our liver, our skin, neurological problems, problems in our feet or hands. So every single system in our body can be damaged because of diabetes. That's why so many people die from it, because of all of these other secondary consequences that happen because of diabetes. So you probably know someone who's maybe lost a leg because of diabetes, or has problems with their kidneys because of diabetes, or very commonly people have problems with their eyesight because they've had diabetes for many years. And so, like we talked about, people can go for years and years without feeling anything and having diabetes. But if they had known that they had diabetes years before, they could have prevented all of these problems to happen in the future. But once these appear, now it's very difficult, right? Because now you're treating all sorts of problems in the body that could have been prevented if we had just known 5, 6, 7 years before. Now, for a screening, we try to understand and determine the risk of developing prediabetes or diabetes. And so the things that we can measure that tell us whether you are at risk or not for diabetes is your family health history. So whether if you have family members who have the history of diabetes, parents, grandparents, uncles, in your family that have diabetes. If they do, that puts you at higher risk. Your age, the older you are, the higher your risk for diabetes. Your personal history as well. So if you have other diseases like high blood pressure, for example, that also increases your risk for diabetes. Now your race as well. For example, with Hispanics like me and probably most of you, we are at higher risk of diabetes just because of our race. And also having other diseases that, like the ones we talked, like gestational diabetes, that puts you at risk later on in life for type 2 diabetes. But as you look at these factors, one thing that you can notice is that you can't change them, right? You can't change your family history, whether your mom had diabetes or not, or your age, you're as old as you are, or your race. So these are factors that are fixed and that you can't do anything about. But some people think that if they're at high risk because of these things, so like their family has diabetes, then there's nothing to do and you should just give up because you're going to have diabetes anyway, no matter what. And that's not true, because even though these things put you at higher risk, there are other factors that you can change and that are modifiable that can make a difference whether or not you have diabetes in the future. So, for example, losing weight, lowering your cholesterol, or lowering your blood pressure if you have blood pressure. These factors can reduce your risk of diabetes in the future. Also, exercising, having a healthy diet, and not smoking can also reduce your risk of having diabetes in the future. So these things you can change. And so if you know someone who has many of the other risk factors, a way to look at it is to say, well, you're at risk for diabetes, but there's these things that you can do to lower that risk so that you don't have diabetes in the future. And so when you do your screenings for diabetes with your family, which are in your resources for in the website for your micro-credential, you'll ask 6 different questions about risk factors that people have for diabetes, and you're gonna grade them according to that. And if they have 4 or more points, that means they're at high risk for diabetes. And if they are at high risk, then you're going to tell them that they're at risk, right? We talked about this is not a diagnosis. You're not telling them that they have diabetes. You're saying that they're at risk, which means that they can they might have the disease, or they might very likely have it in the future. But if we do some changes in their lifestyle, we can lower that risk so that that doesn't happen, and so that they don't have to go through all of those other problems in the many organs and systems that we talked about. So things that they can do is lose weight, eat healthier, and increase their activity. Now, many people think that when you tell them that oh, I'm not gonna be able to do that, because that just means diet and exercise, and I've done that so many times, so I'm not gonna be able to lose weight and stop eating. But the thing is that we're not asking for huge drastic changes, because most people, when they talk about diet and exercise, they're talking about looking a certain way. So like wanting to lose like 50 pounds or 30 pounds to look a certain way, like your favorite celebrity, for example. But that's not the case. Studies show that, for example, losing 5% of your body weight, so just 5% of your body weight, um, decreases your risk of diabetes by about 20%, which is a lot. And uh, exercising 3 to 4 times a week for 20 to 30 minutes at a moderate pace decreases your risk of diabetes by 20-25%. So that's a huge change in risk for a very, very small change in your habits. So it's 5% weight loss or 20 to 30 minutes of exercise, 3 to 4 times a week. That's it. And so you're really not asking them to look like The Rock. You're just asking them to look a little better, and do some little changes that will really make sure that they lower the risk for diabetes in the future. Okay, so that's diabetes. And so you'll do the questions, and the questions around diabetes for the screening really are around those risk factors that we talked about. So their age, whether their gender, their height, if they have some of those other risk factors that we talked about. So you'll go through the questions one by one, you'll add the points, and if they have 4 or more points, that means they're at high risk of diabetes. Not that they have it, but that they're at risk. And if they're at risk, you'll provide them with the resources. So there's presentations, there's videos that are all for free, or there's classes of varying lengths that they can take, all free, so that they can know a little more on how they can make those changes in their lifestyle to really make a difference in their life so that they don't get diabetes. And the great thing about this is that you're there, right? Because they're people that you know. So you can keep up with them, whether they make a plan or you help them make a plan. You can follow up with them. Sometimes people listen a lot more to their family members than even their doctor, because you're there. So if they forget and they stop exercising, you can remind them, hey, do you want to go for a walk with me? Can we go, and I'll help you exercise, those 3 to 4 times a week. And so you can do that for them. Okay, so for high blood pressure, we have, let's go into our second screening. So high blood pressure, it's very much like diabetes in many ways. And in the sense that you can have this disease that a lot of people have and not know about. It's even called the silent killer, because you can have this disease that has all of these problems in the future, but that for many years you don't know about, or that you don't have any symptoms. So you can have the disease and not know it for many years until it's really late and there's a huge problem that happens. Sort of like diabetes. Like 1 in 5 people don't know that they have high blood pressure. And that's a huge problem, because years later, they can have a stroke or an infarct, or so many different problems because of it. So let's talk about what high blood pressure is. So high blood pressure, so think of pressure like the pressure in the pipes in your house, right? So if you want water to come out, there has to be some pressure pushing that water forward so that it comes out of the pipes and into the faucet. But if the pressure was too high, what would happen to those pipes? Well, they would burst, right? Or at least start leaking. Well, the same thing can happen in our body, in our circulatory system. So our heart is pumping blood all across our body, and as it's doing that, it creates a pressure gradient. So our heart pumps the blood forward, and that that blood then moves forward, and that's the point of highest pressure. Then the blood moves all of across her body and then goes back into her heart, and it goes back into her heart so it can pump it again. So when our heart is relaxing to let that blood go into our heart so it can pump it again, that's when the pressure is lowest. So that's why we have two pressure numbers that we measure. You might be more familiar with heart rate, which is measures how many times your heart pumps per minute, right? Which normally is around 60 or at least below 90. But as it's pumping that every single time, there's also this pressure gradient of when our heart pumps blood forward, that pressure increases, and that number is usually around 120 millimeters of mercury. And then when our heart relaxes to let that blood back into the heart so it can pump it again, that number is around 80 millimeters of mercury. So you might have seen, or if you ever see a measurement of blood pressure, it has two numbers. And so those are the two numbers that you're measuring. 120 over 80 is normal, or anything below that is normal, right? Other than 0, because that means you're dead. But 100 over 60, very normal. 80 over 60, very normal. But like we talked about, the problem comes in when blood pressure is too high. So if the pressure in the system's too high, then we can start having problems, because then that high pressure starts causing problems in the lining of our arteries and veins, and can even clog them, or can even cause them to burst. And so we call that a hemorrhage, because there's blood that starts going out of that artery that burst and going to places where it shouldn't go, and then that blood can't be transported into the cells in those areas that are affected. So the higher the pressure is, the worse it can be. So that's how we measure it. And so, for example, if you see someone who, let's say you take your grandma to CVS or sometimes Costco or even in the mall, where they have one of those machines that can measure high blood pressure, and you check that for them, and it's, let's say, 130 over 90, well, would you say that they have high blood pressure? Well, that's kind of a trick question, because like we said, this is a measurement, this is a screening, and so we're not doing a diagnosis. You're not saying that they have the disease, but you're saying that they might have the disease, right? That they're at risk for having high blood pressure. So, for example, you could have 130 over 90 at some point because you ran up the stairs, or even when we are nervous because of an exam, or you're seeing your boyfriend or your girlfriend, and so your heart rate and your blood pressure can go up for a little bit, right? It's only when it's constantly high that we would say you have the disease, and so for that you have to measure it multiple times. So if you check someone, you should again let them know about it and help them get resources and make changes in their lifestyle, that the resource that you have in your website, or get them help. But you don't have to say that they have the disease, because this is just a risk. And like we talked about with diabetes, with stroke, there's all of these different problems that can happen well, I'm sorry, with high blood pressure, there's all these problems that can happen, like vision loss. We can have a heart attack, problems with our kidneys, our heart. We can have all sorts of problems with our heart, and even a stroke. So all of these problems happen because of high blood pressure, and it can be um, really, really bad, all the way up to losing your life because of it. One of the worst things that can happen, most devastating, is a stroke. Stroke occurs when a blood vessel that's carrying oxygen and nutrients to the brain gets blocked by a clot, for example, or it bursts or ruptures, like we talked about, because of the high blood pressure. So when that happens, part of the brain cannot get blood and oxygen it needs, so the brain cells start to die. And about 32,000 brain cells die every second. So the longer it passes before you get help, then the worse it is for someone who has a stroke. So some things that we can do, like to know whether or not someone's having a stroke, is using this acronym in English, which is Be Fast. And so we can look at their balance. There can be problems with their coordination, or they can't move properly. Their eyes, they can see blurry or have sudden changes in their vision. Their face, they suddenly start feeling weak, or they can't move a side of their face because they lose movement of the muscles because of that stroke that's happening in their brain. Or that the same thing can happen in our arms and legs, start feeling weak or can't move them or don't have the same strength. And as well as speech, sometimes people will have problems speaking because they can't move the muscles in their mouth to speak properly. And so the T for time means it's very sudden. So the time it passes for this to happen, it can be very, very fast. Another way to remember this very same thing is the acronym RAPIDO, which is the same thing as Be Fast, just in Spanish. But it also talks to that loss of motion in the face, in equilibrium, your arms and legs, the loss of vision, as well as the inability to speak properly. And so the need to call for help immediately, because the faster they can get someone help, then they can really recover and not have any consequences because of this stroke. But if it takes for too long for people to get help, then the problems that can happen because of that can lead all the way to death, or losing your ability to move, or cognitive impairment even. So really important that if you see any of these signs, you call 911. Okay, so the last screening that you will do as part of your micro-credential is called Social Determinants of Health. So social determinants of health is a fairly new idea, and it's really simple. It's really talking about the social factors that determine someone's health, because many times we think about things that affect our health, like our genes or the way we eat, our lifestyle, whether or not we exercise. So all of these factors do affect our health, right? Or those individual factors. But there's also other social factors that can determine our health in many ways that very many often we don't think about. And so some of those social determinants of health, for example, are our ability to have access to nutritious food, right? So if we can't eat properly because we don't have the right foods, because either the store is too far and we don't have a car, and so we can only eat things that are last long, like in a can. And so we can't have fresh fruit, but we only have access to like canned fruit that is high in fructose and sugar. Or if, for example, that your doctor tells you that you should exercise more, but you don't have money to go to a gym, and your neighborhood is not safe, and so you can't go out at night to walk or run or exercise, well then even if you wanted to exercise and eat better, you can't, right? Because that social environment is not allowing you a chance to improve your health. So being a stable home, not having access to healthcare or insurance, having access to uh, a food or or a stable community, then all of these factors eventually later on in life affect your health. So if you have someone who, for example, just had a, a car accident, they can't walk really well, and they don't have a car anymore, and they don't have family that can take him to the doctor, and in his neighborhood there's very poor transportation, and he's not going to be able to make it to the monthly visit to get their medication, right? So they're going to get sicker and sicker. And let's say that a neighbor's able to take them to the doctor, and the doctor tells them, well, you need to eat more vegetables and fruits, and you need to do a little more exercise. And they really, really want to do it because they don't want to get diabetes and high blood pressure. But when they get home, and they only have this neighbor that can only take them to the grocery store once a month to get some fruits and vegetables. So he gets some, but 2 weeks later, like he's eaten most of it, and what he has left is rotten because fruits and vegetables don't last for a whole month. So now he has all 2 weeks. He doesn't have any fruits and vegetables because the little market store by the gas station doesn't have any. Then he's gonna go without for a whole 2 weeks, and that's going to affect whether or not he gets diabetes later on. Most likely, if this continues, he will. And it's just going to get worse and worse and worse because of all of these things. And if he loses healthcare or insurance, it's just going to get worse. And if he loses that one neighbor that was helping him, that's even worse, right? So we have to acknowledge that there's people that not because of a fault of their own, but just because of the environment and the social factors around them, can really get sick because of those things. So you're going to do a screening for these social determinants of health, which is about 10 questions asking about these different things. And what I would ask you to do is, as you're going through those questions, maybe they say that they don't have a problem with 8 of them, but maybe they have a problem with, they don't have insurance. Well, you can help them come up with a plan and call one of the free numbers that can help you to ask how to get insurance in Spanish, and get them the help to know how they can get insurance. And maybe they'll say, well, I don't need insurance because I've never been sick, but this is prevention, right? Maybe you've been healthy all your life, but you don't know what's going to happen tomorrow. Or maybe they say that they don't eat fruits and vegetables, and so you can help them make a plan. And okay, what can we do to make you eat a little more fruits and vegetables? Or how can I help you to do a little more exercise? Can we go on a walk, every other day? Can I help you exercise in some way? So make a plan where you can help them meet those needs on those resources, and use the resources that you have in your website as well to provide them with help that they might need in any of these social determinants of health. Because might not be that um, they're gonna get sick immediately because of one of these, but eventually they all lead to disease and problems later on. So the last thing that I would tell you all is that as you do all these screenings, it might feel like it's a very simple thing, like you're just asking for some questions and that's it, right? But it's a huge deal because if you can prevent someone from getting one of these diseases, then you can you can change their life for the next 50 years. For example, how much do you guys think that a heart transplant costs? It can be up to $1 million. And you know, it's a great thing that we have the ability and technology and skill to be able to do a heart transplant and give someone that a new chance in life if they need one. But imagine if that person had gone to screening for diabetes and high blood pressure, 20 years ago, and they noticed that they were high risk for them, and they've made some lifestyle changes, small lifestyle changes that prevented them from ever having those diseases, then they wouldn't have gone through all that heartache and hardship and problems and treatments and other diseases that led them all the way to needing a new heart. So in essence, if you do this and you help someone make those changes and get those resources so that they never get that disease, you're doing the same thing that that heart transplant doctor, just by doing a screening, except that you're doing it much earlier and avoiding all of those other problems that come along the way. So you can really make a difference in someone's life by just asking a few simple questions. So thank you for trying this micro-credential, for doing this, and hope it really helps you get an understanding and appreciation for healthcare, as well as the ability to help others in your community and your family to get the resources they might need if you see them to be at risk for one of these diseases. So I'll leave you there, and I appreciate your time, and have a great day.